Good afternoon, and thank you for joining us for our weekly updates. Today I'm so pleased to be joined by Dr. Lawrence Lowe, our Medical Officer of Health for Peel Region, Tim Beckett, our Fire Chief and Director of Emergency Management, and Dave Wojcik, who is the President and the CEO of the Mississauga Board of Trade. I hope that everyone is soaking up the sun for these last few weeks of summer. I'm happy to report that we are in good shape here in Mississauga with our daily case counts holding steady in the very low single digits. However, there is a concerning trend that we're seeing here in Peel and frankly right across the GTHA, and it's a shift in new cases from the older 50-plus demographic to younger age groups. More than half of all new cases in Peel in the last 2 weeks were people under the age of 40. From drinks with friends at the bar to returning to workplaces and traveling more frequently, we have to remain cautious. This virus doesn't move on its own. It needs people to move it. It needs us to move it. So please, if and where you can, please limit your movements. While seeing friends and family, it's all well and good. There's no need to fill up your social calendars just now or expand your bubble. At this point, we understand that young people are not as severely impacted by this virus, but that certainly doesn't mean that they can't easily transmit it to their aging parents or grandparents or more vulnerable populations. Being young does not make you immune to COVID-19. It certainly does not make you invincible. The choices you make could make a difference between life and death for someone else. So please, please be careful. Along with the large GTHA mayors and chairs, I ask that we turn our focus to the Labor Day weekend. We recommit ourselves to following the advice of public health. Please keep your distance, 2 meters, 6 feet, wear a mask, wash your hands frequently, limit your social interactions, and stay within your bubble. And if you're sick, please stay home. Restart and recovery can only be successful if we keep moving forward and making progress. We know that there's a lot of anxiety around the fall and what it could bring in terms of a second wave. I want you to know that we are ready and we are prepared. But we need to work together to keep the case counts down. And as Dr. Tam said, work for a slow burn, not a wildfire. As a city, we continue to take a slow and phased approach to reopening. Staff are busy here at the city preparing to reopen our community centers on September 8th, and residents can now register for our modified fall recreation programming, including swimming, skating, fitness, and library programming. Programs start on September 21st, and residents can register on activemississauga.ca website. Our physically distanced drive-in Raptors viewing party at the Paramount Fine Food Centre also continues to be a huge success, with tickets to every game in round one selling out. It's great to see the energy levels high with fans out in full force, wearing their jerseys with pride. And now that the Raptors have swept the Nets, we're preparing to welcome the fans for their first game against the Celtics this Thursday at 6:30 p.m. And there are still some tickets available, and you can get yours at ParamountFineFoods.com at that website, but you must reserve in advance. So get yours if you don't want to miss out. So let's defend the North. Before I turn it over to Dr. Lowe, I wanted to provide a brief update on our decision at last week's Peel Police Board meeting to approve body-worn cameras for all frontline police officers. I was proud to move this motion, and I'm very pleased that it passed unanimously. Body-worn cameras will provide police with the data and the intel they need to fight crime, while increasing transparency, trust, and accountability. We realize this is not a panacea to the calls for increased police accountability, but it's a step in the right direction. And I want to thank the community and the police for their support, especially the chief, for their support to move forward with this. I want to assure the public, as I know Chief Nish has many, many times, that all the data collected will be stored and will be very secure. I want to thank Chief Nish for his leadership on this, and also my colleague, Mayor Brown, for being a strong advocate as well. In terms of timelines, the earliest we can expect our 2,000 frontline officers to be wearing these cameras is sometime this fall. And with that, I will now turn it over to our Peel Regional Chief Medical Officer of Health, Dr. Lawrence Lowe, for providing us with a brief update. Thank you. I think you want to grab the sanitizer, maybe bring it here. Thank you.
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 3,081 cases of COVID-19 in Mississauga. 83 are active, 2,767 have recovered, and 231 have passed away. We are now a month into stage 3, and across the region of Peel, we are now seeing cases edge up again, driven by new cases detected amongst people aged 20 to 50, and also associated with travel, workplace, and social exposures. We know that the risk of a second wave is very real, particularly as our community continues to broadly reopen around schools in the fall and cold weather approaches. To recall something that Mayor Crombie said throughout the spring, it's important that we do this right, and we do it once. And as someone who falls into this younger demographic, I absolutely get it. 2020 was supposed to be our year, and any other year the summer would have been filled with meeting new friends, arranging playdates for kids, charting new courses, finding adventures and challenges. What you can put on pause for the moment is important, because delaying things in some way is how we are going to keep our loved ones safe. Our greatest challenge right now continues to be COVID-19. We're all in this together, and we came together and sacrificed to bring this under control, and we now have a chance to get some of our lives back. But that all goes out the window if we throw things to the wind. Pandemic times are hard times, and I know that many are struggling. We can't wish that this would all go away, or worse, simply ignore what's happening. Because this disease spreads from person to person, every person must do their part to stop the spread. More COVID-19 just makes it harder for us to go on with our lives. Thus, in meeting this challenge, I ask you to consider a few things. Firstly, federal recommendations are clear. Now is not a great time to travel outside of Canada. And if you do have to go for essential reasons, please self-isolate for 14 days when you return to our community from abroad in accordance with mandatory quarantine regulations. Whether you're at work, out for errands, or socializing, ensure that you are practicing the core 4 behaviors with people outside of your social circle. A physical distance of 2 meters, masking where it is mandated or where distancing is difficult, washing your hands frequently, and staying home and getting tested if you are sick. If you run a business or a workplace, keep your workplace safety plan for COVID-19 up to date and ensure that it is acted on. Ensure that there are relevant precautions in place to protect your staff and your workers. If you're hosting gatherings, limit proximity, duration, and numbers. Make sure your guests can practice the core 4. Coming together safely is going to be even more important as we move indoors in the fall and winter. It's also important to keep using virtual or remote options where you can. Keep track of who's in your social circle and who you interact with outside of it, and download the COVID Alert app as an added security measure. And please, this fall, make sure you get your flu shot when it becomes available. As we move into the fall, we must remain vigilant, especially in indoor spaces, to prevent COVID-19 from spreading as schools reopen. And trust me, I wish this were easier, but these are not ordinary times. This is a global pandemic, and thankfully, we got things mostly right here in Canada, but it means a second wave is within our control to stop. And remember, there is no secret to what we need to do to keep our hard-fought goals. The hard part is doing it, keeping our community open and COVID down as we move forward with our lives. Let's do this right, and let's do this once. Thank you, and I'll pass it back to you, Madam Mayor.
Thank you, Dr. Lowe. As you can see, the stakes are high. We need to remain laser focused on our efforts to fight this virus. Our people and our businesses simply cannot afford to do this again. Our small business community has arguably been some of the hardest hit by this pandemic. But the good news is that their doors are open once again and that they are on the road to recovery. In addition to the lost revenues, they're also working to manage the costs of doing business in a post-pandemic world, from PPE to plexiglass shields, enhanced cleaning measures, and so much more. Recovery will take some time, and I want our local business community to know that our city and our people will be there to support them every step of the way. Our small businesses need to know that we have their backs in the weeks, in the months to come. And this is why I'm thrilled to be announcing that the City of Mississauga will be putting our support behind Canada United Small Business Recovery Campaign this weekend from August 28th through to the 30th. For every like, view, share, or follow on Canada United social networks, RBC will donate 5 cents towards small business recovery grant funding. Very exciting. These grants and benefits will benefit small businesses in our city and help them get back on their feet. So please, get out your phones and get busy on social media and show your support. I will be out with the Mississauga Board of Trade, with Tourism Mississauga and local BIAs, spreading the word this Friday, visiting small businesses in Cooksville, Malton, and in Streetsville, where we will be promoting Canada United and encouraging businesses to join Mississauga Made, our very own Buy and Shop Local campaign. Over 100 small businesses have already signed up for free online marketplace to promote their products and their services. As part of the campaign, we will also be giving away free Mississauga-made window decals to small businesses so that they can proudly show their support while encouraging customers to buy and to shop local. Shop Mississauga, shop local, and show your support, Mississauga. And with that, I now invite Dave Wojcik, President and CEO of the Mississauga Board of Trade, to speak a little more about how MBOT is supporting this campaign along with the Ontario Chambers of Commerce. David, over to you.
Well, thank you, Madam Mayor, and Dr. Lowe, I want to commend you and your team for putting out a toolkit for businesses that was launched this week, a very comprehensive toolkit for businesses, and of course to Chief Beckett, who's always been doing a fantastic job for our community. The Mississauga Board of Trade is pleased to join this news conference today as we are heading into a very special weekend for local business. August 28th to 30th marks Canada United Weekend, a special initiative of the Ontario Chamber of Commerce and sponsored by Royal Bank. This weekend promotes shopping and dining at small and local business. We believe this will be the first year of a new annual shopping weekend in support of small and local businesses. The aim is to encourage consumers to shop and dine throughout the weekend to help kickstart our local economies. RBC has also created a contest with $250,000 of cash prizes to help get customers to shop and dine from August 28th to the 30th. Purchases at all Canada United partners will also qualify. I look forward to joining you, Mayor Crombie, and local Business Improvement Association members as we visit businesses in Malton, Cooksville, and Streetsville this Friday, August 28th. Canadians are also encouraged to watch the Canada United videos online at gocanadaunited.ca, and we would also appreciate it if you would hit that like button on posts from at Go Canada United on social media, and use the hashtag Canada United to demonstrate your support. Every time you use the at Go Canada United or hashtag Canada United, RBC will contribute 5 cents up to a maximum contribution of $2 million to the new Canada United Small Business Relief Fund, while working with government and corporate partners to source additional contributions to the fund during the course of the campaign. As the Mayor said, the campaign runs until Sunday midnight, so please go out and support your local businesses. The fund will provide small businesses with grants of up to $5,000 to cover expenses related to personal protective equipment, renovations to accommodate reopening guidelines, and developing or improving e-commerce capabilities. We expect many Mississauga businesses will apply. Small business owners who are interested in the program can visit gocanadaunited.ca to learn more about the grant application details, including eligibility criteria and how to apply. The COVID-19 pandemic has surely been the most significant economic hit to Canada since the Great Depression. Millions of businesses across Canada and right here in Mississauga have permanently been affected and have not been able to survive. But your Mississauga Board of Trade and Chamber of Commerce network have been instrumental in supporting and advocating for businesses at all orders of government, and we again want to publicly thank Mayor Crombie and Mississauga City Council and staff for working with the Mississauga Board of Trade in our efforts. Finally, to quote my colleague Rocco Rossi, the President and CEO of the Ontario Chamber of Commerce, if there has been one silver lining in all the tragedy and sacrifices of the current crisis, it has been the spirit of collaboration and unity of purpose that has been evident between levels of government across provinces and across sectors. We are calling on that same unity of purpose with Canada United. Small local businesses are at the heart of our communities, our main streets, and our economy. Together, it is time to show local some love. I echo those sentiments, and I encourage each and every one of you to shop local and support your neighborhood businesses. Please respect all of the things that Dr. Lowe has said: physical distance, masks, hand sanitizing, and if you're not feeling well, please stay home. Thank you. Mayor Crombie.
I want to thank Dave Wojcik from the Mississauga Board of Trade and Dr. Lawrence Lowe, our Chief Medical Officer of Health, for joining me today, and happy to take any questions from the media if there are any.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead. Hi, Mayor Crombie.
Good morning, or good afternoon, Ashley.
Yes, good afternoon. So I actually wanted to get your thoughts on what looks to be an ongoing situation at the Art Gallery of Mississauga. Earlier this summer, some former employees came forward. They launched a website, and they accused the gallery's directors of racism, harassment, and bullying. So I know that the AGM is its own entity with its own leadership and everything like that, but the city does provide some funding to the AGM. I'm just kind of wondering what your thoughts are on the controversy, and if you think the city is reducing or eliminating funding in response to the controversy in the future.
So you are quite right. We are monitoring the situation very closely, but the Art Gallery of Mississauga is a separate and autonomous not-for-profit organization, and it is governed by a board of directors with their own policies. That said, we have a commitment to to ensure that all of our policies are committed to equity, inclusion, and assuring of a safe and respectful workplace, and that the requirements of these groups are met to ensure ongoing funding in the future. So we want to ensure that they do maintain a safe and respectful workplace, and those are the requirements that we insist upon to ensure that they are funded in the future. So our team is monitoring the issue. We remain in regular contact with them and the AGM's leadership group over the balance of the year and the current funding year, in fact. So it is a serious situation, Ashley, and we are closely monitoring it and working with them.
Thank you. My follow-up question is actually for Dr. Lowe.
Certainly.
Go ahead, Ashley.
So you had mentioned earlier today that cases are increasing in Peel, and we also know that Peel typically accounts for a good chunk of new cases in Ontario every day. But one thing we've been seeing a lot of is a big disparity in cases between Brampton and Mississauga. I think the numbers on Peel's website for August 25th said that 31 new cases in Peel, 26 alone were in Brampton. You've talked about how the cases are related to workplace, travel, socializing. Do you have any theories or ideas of what's causing the disparity between the two cities and why Brampton's cases are consistently higher than Mississauga's?
Well, so it's certainly a trend that we are looking into. I think the more important thing is that many of our new cases, fortunately at this point in time, are linked to known exposures, known sites. So when we talk about workplaces or social gatherings, there are specific workplaces that have been identified where an exposure has occurred. There are specific social gatherings that are identified where an exposure may have occurred. And a lot of that has been driving the picture. And then so what happens is obviously if there's a workplace with say 15 or 20 people, a number of them exposed and come back positive, that's essentially what you're seeing in terms of reflecting things as to where it is. But it's not representing, I would say, undifferentiated spread in either municipality. It's more reflective of a known exposure, and many of those cases linked into a specific exposure that is located in one of those municipalities. So far it's been, we've seen more activity in Brampton, and a lot of that, as I think we saw earlier in the pandemic, is related to the nature of the employment profile differences that exist between the cities, as well as the nature of living conditions for some of the residents, some of whom may live in more crowded or multi-generational households, at least as we saw in Brampton. Thank you for the question.
Thank you, Ashley.
Your next question comes from Steve from the Mississauga News. Steve, please go ahead.
Hi, Steve.
Hi there, Crombie. How are you?
I'm very well. How about you?
Thanks. We learned earlier this month that your current Chief of Staff, Rob Schwarther, is becoming Director of Strategic Initiatives with the City of Mississauga. I looked over Mississauga's kind of older Sunshine List disclosures and haven't seen this position on there kind of dating back to 2015 at least. So two-part question. Why is the city bringing back this position now? And are you concerned about the optics of hiring kind of a new director position while the city is facing a tough financial crunch?
So thank you for the question, and I have to say I'm very excited for Rob, who has endured me for now 9 years, and this is an excellent opportunity for him, and it is an internal transfer, and while it appears to be a promotion, that position has existed for many years. I think it's been more recent than 2015. As you know, Janice Baker was ready to retire, and so she didn't fill the position upon her retirement, was waiting for the new city manager to mold their own staff of their office, the city manager's office, how they so chose. So certainly Rob is transferring over. He will be a director. He's extremely qualified, and I think everyone is very excited for him. He'll be handling city building initiatives. His team will include the waterfront development project management, the new diversity and inclusion, overseeing workplace diversity and inclusion, corporate performance and the innovation team, and some of his priorities will include ensuring that the Hurontario LRT is on time and under budget, and other new developments along the waterfront and the core, as well as advancing our strategic partnerships, overseeing government relations. He'll act as an advisor to the city manager, to the council, and to the city's leadership team. So it's a very exciting time. As I said, it's a transfer, it's a promotion for him, but that is an existing position. So we have not created a new FTE position. It is just one that has lapsed while the previous city manager was in the wind up to her retirement.
Okay, thank you, Mayor Crombie. And starting in September, short-term rentals in Toronto will have to be registered and pay the city in order to operate. Are you interested in implementing a similar program for short-term rentals in Mississauga?
I'm sorry, they have to be which, Steve? I missed that.
Registered and will have to pay a fee to the city in order to operate in Toronto.
Yes, I know there are many changes underway, and we're certainly awaiting staff report to give us some guidance on what sorts of changes are occurring in the municipalities and the GTHA, and we always like to act in unison, and these are some changes that we're anticipating bringing forward in Mississauga as well.
Mayor Crombie, your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Hi, both my questions are actually for Dr. Lowe. If you
Perfect, no problem. Thank you.
Hi, Isaac, go ahead.
Hey, so the province today has unveiled the pandemic strategy for schools, and it places a lot of responsibility on you and the local health units. Got a few questions in terms of how it relates to testing. Obviously, the return to school and interaction of students is going to lead to an increased demand for testing, particularly if cases are identified in schools. Does Peel Public Health have a plan to open additional testing centres anywhere in either Mississauga or Brampton to deal with that demand when schools come back?
Yeah, it's a great question, Isaac. And just to clarify, testing is a provincial responsibility and is administered through Ontario Health. In our region here in Peel, we work as Peel Public Health very closely with Ontario Health Central Region, together with the hospitals who are running the assessment centres. And there are discussions underway, not only in respect of opening up or rationalizing the current assessment centre network, but also looking at other modalities such as on-site, mobile, pop-up testing, all those other pieces. Those are all going into Ontario Health Central Region's testing strategy, and schools are being considered as part of that testing strategy that is being continually revisited. That was the same testing strategy that was put out over the summer that led to the pop-up tests that you saw elsewhere in the region throughout the summer.
Okay, and then my second question kind of ties into that, and I know you have some sway there, you will have your opinion expressed in this, and I'm wondering about elementary school kids in particular. Parents have already taken a lot of time off work to look after children at home when school's been off. A lot of them have run out of vacation time, things like that. Would you recommend or be advocating for any specific measures to allow elementary school children to be tested at ideal times for parents, or perhaps on site, as you mentioned, something like that?
Well, I think we would, so it's a great question, Isaac. At this time, the current provincial guidance really speaks to the need to test in the context of a case or an outbreak in a school setting, and it really speaks to individuals who are symptomatic as well as their close contacts. So I think in the course of that, whether it's elementary or secondary school, at this time we would adhere to that provincial guidance, and any broader testing beyond that is certainly something that would need to come from and be directed by the Ministry of Health and the Ministry of Education. Thank you very much for the questions.
Thank you, Nicole.
Yeah, your next question comes from Khaled from My Second Home TV. Khaled, please go ahead.
Welcome, Khaled.
We have you there, Khaled?
Can you hear me?
Oh, not very well, Khaled, unfortunately. You're reverberating and echoing.
I see. Is it better?
Yes, a little bit.
Very sorry about that.
No problem. You can always email your question in to Nicole and she can read it to me.
Absolutely.
Okay, thank you, Khaled. If you just want to email your question, we'll help you out there. There's no further questions, Mayor Crombie. That's it for today.
Thank you very much.
For joining on behalf of the mayor. This concludes today's press conference. Have a great rest of the day.
Thank you.